Welcome back, everybody. It's Dr. Schu here, Premier Chiropractic and Performance in Jacksonville. Today we have actually our new chiropractic assistant, Haley, in the office. So if you've been in recently, hopefully you've been able to introduce yourself to her. Love having her in the office. However, she's dealing with some knee pain. Has several knee injuries over the past few years. Is an active rugby player. Went to college to play lacrosse. Ended up doing some rugby up in Colorado, right?
Yes.
What college was it?
Colorado Mesa University.
Mesa University in Colorado?
Yeah.
Very nice. So she's highly involved in sports, plays on the local female rugby team here, the Centers, right?
Yes.
You guys are trying to start back up your season after this whole COVID pandemic. So
hopefully next Thursday.
So been practicing a little bit of the evenings, been having some swelling of that knee, some pain, some aches and pains, but nothing too severe. Lateral meniscus injury, did have it repaired, a little bit removed, and then also ACL repaired.
Mm-hmm.
How many years ago was that?
7.
7 years ago. So pretty chronic knee injury. Gone through a bunch of rehab, different treatment, but just one of those things that once it kind of happens, especially surgery, you got to stay on top of it, especially if you're active in sports, things like that. So what we're doing right now is a protocol that we use in the office called FACTOR. Stands for Functional and Kinematic Treatment with Rehab. So what we're doing right now is a little bit of instrument assisted soft tissue technique. We're trying to manipulate the soft tissue underneath the skin, the muscle, the fascia, trying to mobilize that a little bit. So we're just kind of coming around that knee joint, and you'll start to see it turn red. That's that blood flow starting to happen, bring that inflammation to that area so we can, continue the healing process, get that recovery going in that medial knee or lateral knee. She does get a little swelling in there, so trying to get some of that fluid moving as well, get it pushed out of that knee a little bit. You got practice tonight?
No.
Anything this weekend?
No.
Thankfully. So a little time off.
Yeah.
What position you play? All over?
Yeah, I play quite a few.
Okay.
Mostly in the, what I call baby rhinos. You're just gonna hit things a lot.
So a lot of impact, huh?
Yeah.
It's the fun part.
It is the fun part.
Where do you guys typically play here in Jax?
Off of 295 and Gate Parkway. There's a park there called Fort Family.
Nice.
It's one of the few parks that has their uprights intact.
So you can kind of see it getting red right in this area here. That's all that inflammation, like I said. What we're looking for is something called petechia. It's where it really gets red, really bruised in that area. You'll start to see some bright red spots, and that's kind of lets us know that we've kind of reached our limit, done what we've tried to accomplish in this area. The other thing too that we can do with this tool is you'll see that has different edges on it. It has this beveled edge, and that's what we're using to manipulate that soft tissue in that area. But you'll see it has some certain ridges, some certain cutouts. That way we can get in different areas of the body, different joint areas that are a little bit narrow, a little bit wider. We can also get in really narrow, so we can actually get in between this joint space right here where that meniscus lies, and we can actually get in there and get a lot of good motion right in there. You may see her squirm a little bit. Sometimes we can hit a spot that's a little tender, especially when we're getting right in that joint area. You okay with that?
Oh yeah.
Not too bad?
No, I'm ticklish.
We get that too. All right, so what we're gonna do next is we're gonna get her knee cleaned up, get some of this cream off there, and then we're actually going to apply some dynamic tape, give her some support off that, take some pressure off that lateral knee so she can move around a little bit better. Practice, I know she doesn't have much going this weekend, but I'm sure you'll find something to do, so we'll take a little pressure off that knee and hopefully get some of that swelling down in that area too. All right, so we've got her knee cleaned up. We're gonna apply this tape now, but we're gonna do it in a way, like I said earlier, that's gonna take a lot of pressure off this lateral side. So we're gonna apply kind of a stable strip right here. Just comes off this side of the knee. We're gonna come straight up the leg, more so up into her quad area. Not a whole lot of stretch there, just a little bit. We're going to come with this little thicker piece, and we're actually going to have her knee rotate in a little bit of a lateral direction there, and we're going to kind of come across with this tape and come up that lateral side. And the cool thing about this tape, I'm sure you've heard me talk about it in my past videos, but it has a four-way stretch to it. Very different from a lot of the kinesio tapes that are out there. Not that's anything wrong with those, this is just a little different. And it's applied a little differently to, you know, get different results. So there's tape for, you know, pretty much everything that you're trying to do. This is essentially, we're trying to offload joints. So we're actually trying to take pressure off that joint. And I'm sure once she gets up, starts walking around, she'll let you know that she'll feel a little bit of a pull off that tape, and more so on that medial portion, but a lot of pressure is being taken off that lateral portion there. So we're just gonna try to rotate that knee a little bit out. We're gonna come around with this tape, and we're going straight up the leg like we just did with that stable strip. Get a little bit of roll there, but that's okay because this tape is very, very sticky. And if you're using this tape, highly advise that you do not rip it off. It will take skin off. So, special way to take it off. You gotta get in the shower, get it really wet. Use some oils if need to, but very, very slowly. How's it feel?
Good.
All right, so we've done a little bit of factor protocol on that knee. We've taped the knee. So she's just gonna walk around a little bit, let us know what she feels, how it's going. So feeling a little bit of pressure off that knee?
Yeah. Yeah.
Do you feel like it's pulling towards that outside, that lateral portion?
I don't know that it's like pulling, but I can definitely see what you mean by taking the pressure off of the outside.
Yeah.
Mm-hmm.
Does the tape limit your range of motion at all? Are you able to actually go through it? Doesn't feel restrictive?
No.
Do you feel like you could play with this on?
Yes.
And still be able to full go? It's not restrictive at all with running or?
Yeah.
Awesome. Awesome.
Literally, as long as I can run and squat, we're good.
Good. Good deal. Well, that's kind of our protocol. Again, sometimes we'll look below that joint, we'll go into the ankle if there's a lot of ankle issues or hip issues or even low back issues and kind of surround that joint. But I appreciate you guys watching. As always, Make sure you go follow us on Facebook and Instagram for more videos just like this one. Hit subscribe on that YouTube channel, and make sure you check us out at premierchirojax.com to schedule appointments with us here in Jacksonville. So again, thanks for watching, and we'll talk to you soon.